Hey Sierra Respiratory Team, we're going to shoot another video on setting up and prepping for a bedside percutaneous tracheostomy. This here is Timmy trach tube. We're going to get that tube out of him and get him a trach here pretty soon. So I'm going to walk you through everything you want to set up for the surgeon, yourself, and for the pulmonary intensivist. So let's get right to it. First things first, we have our glide scope here. You'll need a bronchoscope. I'm not going to pull that out of the package. And then on our side of the bed with the pulmonary intensivist and the respiratory therapist, we'll need 2 gowns, so essentially 2 sets of everything as far as PPE, some protective eyewear. Remember, we're going to put a trach in, so we're going to want to change that normal length Ballard to the tracheostomy tube length Ballard here with our trach tie and an Omniflex to prepare for the transition over to the trach tube. Again, more PPE, a couple of masks. You'll want to use your swivel adapter, the fiber optic bronchoscope swivel adapter to go down the tube. You'll need some lube and a couple of dry 4x4 gauzes for your intensivist to grip his bronchoscope there. You'll have a little saline and a bowl. We don't use those much, as you guys know, but we'll have them at the bedside just in case you need to do a quick bronch and clean up afterward. And again, more PPE for your bronchoscopist and intensivist. All right, we'll head over here to the surgeon side of the bed. You'll need 1 blue rhino trach kit at the bedside. We'll also have another one just in case anything goes awry and they drop something or something breaks. You'll have 2 chloropreps to set up there. Again, more PPE. And important, you'll need a neck roll to put behind their neck to kind of position the trachea for a good visual. And then we always bring in 2 trach tubes as well, just in case one goes down or pops a cuff or gets dropped on the floor. So 2 of those, and again, a gown. Okay, and that's it. And then what we're gonna do is store those, as you see here, in the back room. There's your surgeon stuff, so if you get to do the bronch and you need to restock everything, there's everything you need right there. And the same thing for your respiratory therapist, for yourself, and your pulmonary intensivist. Everything you would need to restock everything right there. And we'll keep those bins in the back room in our closet.